we're all watching the news round the clock, and we're seeing the images of people, medical professionals wearing masks and protective gear and rushing around, and this sense from our news anchors of impending doom almost. You're in the front line, you're in the emergency room. We were just talking about it just a few seconds ago. Can you tell me what it feels like to be in the emergency room right now as the surge is, I think, is about to explode?
Sure. I want to be clear that there's a strange familiarity about it. Okay. If you want to experience doom in any emergency room in the United States, just stop by any Friday, even any Wednesday night. It doesn't matter often the day of the week. It's important to understand the baseline that emergency departments and the intensive care units that we admit to are almost always full. Almost always, when I have a very sick patient, my next call, once I stabilize them, is to the ICU doctor who says, I may not have a bed available for maybe 12 hours or more than that. Almost always in every emergency department in this country, the nurse who I work with, he or she is wildly overtaxed. It's an inappropriate patient to provider ratio. So on one hand, what's happening right now is very familiar to all of us, but there's a sickening difference. And that is, on many nights, we are tasked with sort of sorting out what is an emergency and what isn't. We like that job, I think. I certainly do. People come in, they're scared. Sometimes they're just drunk. Sometimes they really are having a heart attack. The sickening difference now is that every case is an actual emergency. And that's something that is terrifying. I don't think any of us have seen that in our career. To give you a sense of the physicality of this is a disease that seems to rapidly attack one's lungs in a way that is unprecedented. Even influenza, if one is unlucky, you may have a few days before you really start to get worse. And yes, you still might need a breathing tube and an ICU, et cetera, but there's warning. This disease gives us very little warning. We have patients who arrive speaking to us, and within 3 or 4 hours, they are breathing to a level that would approximate a treadmill in the gym you used to go to. Can you imagine putting a treadmill up at its highest incline? What is that, level 8, 9? And then cranking up the speed as fast as it can go. And then rolling, run. Well, you know what would happen. You're going to breathe 40, 50 times a minute. And the reality is your body will get exhausted. It can't breathe that fast for that long. That's when we need to put in a breathing tube. And so that's happening on the order of hours in our emergency department. And so I think that that's what's very different than anything we've ever seen before.